Hello, my name is Eka Mardhika. I am neurosurgery resident of Universitas Udayana. Thank you for the opportunity. I would like to present my study entitled Interleukin 6 in cerebrospinal fluid as predictor of outcome in severe traumatic brain injury, which is a systematic review and meta-analysis. So here is the outline that I would like to present from introduction to conclusion. So interleukin 6 is one of the pro-inflammatory cytokine that upregulated after traumatic brain injury. It could be has a protective effect. However, others report that interleukin 6 was associated with mortality in severe traumatic brain injury. So we aim to determine the role of interleukin 6 in cerebrospinal fluid as predictor of outcome in severe traumatic brain injury through meta-analysis. So this is a systematic review and meta-analysis. And we define eligibility criteria based on PICO framework. The P was severe TBI, the I was high interleukin 6, the comparator is low interleukin 6, and the outcome is Glasgow outcome scale, which is divided into two, poor and good outcome. Poor is goes 1 to 3, and good outcome is goes 4 to 5. And we include all studies comparing interleukin 6 in cerebrospinal fluid of severe traumatic brain injury patients. And the keywords that had been used in systematic searching were interleukin 6 and traumatic brain injury. The database included was in PubMed database. So as you can see from the picture below, we found 327 results after we using the keywords. In quality assessment, we used GBI checklist with 2 independent reviewer. The collected data were merged with Software Review Manager 5.3. The mean interleukin 6 were pulled and analysis. Random effect model was used because of high heterogeneity. So this is the Prisma diagram. As we can see, we found 327 literature from systematic searching, and at last 6 articles were included for quantitative synthesis. So we include 5 prospective and 1 retrospective cohort study. The total samples were 202 patients with severe traumatic brain injury that was examined with the cerebrospinal fluid examination. And all of the articles included were in good quality. So we perform random effect model. So as you can see, there is high heterogeneity among studies, and the standardized mean difference of interleukin 6 between unfavorable and favorable outcome was 0.64. As you can see from the forest plot, the pool result, the prism shape is crossing the zero line, so it's not significant clinically. But as you can see, the statistic is significant with 0.03, but however, because it's not clinically significant, we can use that. So increased cerebrospinal fluid levels of interleukin 6 have been associated with mortality and poor outcome in adults traumatic brain injury, especially in multiple trauma patient, and elevated CSF concentration of cytokine may affect brain function. They can reduce the cerebral blood flow both directly by altering the vascular resistance or by hypotensive effect. And interleukin 6 have been known as direct toxic effect by increasing the production of nitric oxide synthase, cyclooxygenase, and free radical, and it will cause the neuroinflammation getting worse. So based on our meta-analysis, however, the interleukin 6 level in cerebrospinal fluid cannot predict the outcome of severe traumatic brain injury because it's not clinically significant. However, the statistically is significant, but not clinically. Thank you.